Deputy Brian Smith.
Thank you, Cancora. Could I just say at the outset I want to agree with what my colleague Deputy Joe Flaherty said in relation to the outstanding success of the vaccine programme. And of course, on different occasions when we spoke here and in the Convention Centre, we were questioning the rollout of the programme and some initial delays, but I have to say that the plan and the programme Minister Donnelly laid out, and he stuck with it, has proven very successful, and I compliment the Minister and his senior officials and the personnel in the HSE on the very, very successful vaccine rollout programme. And I also want to take the opportunity, as other members of the House of all sides have done here, is to pay tribute, quite rightly, to all the clinicians involved in administering the programme, be it nurses, people of different professions within the whole area of healthcare, and also GPs and pharmacists in their own premises. And I also want to take the opportunity to compliment volunteers and retired people who went back to, at this particular time of crisis, to give additional capacity to the health service executive. And I know in my own county and in County Monaghan as well, I spoke to different people who had retired who didn't think they'd work again in the health service, but they went back because they saw it as an opportunity to contribute once again to helping people in a vulnerable position. And I had the double vaccine administered in the centre in Cavan, and it was a joy to be there on each occasion and see the joy on people's faces when they got the vaccine. And I recall very well early on in the programme when the older people aged 80 plus, people aged 70, they got a new lease of life when they got even their first vaccine, and meant a bit of freedom for them. So it has been so important. So, Minister, to everybody, from yourself to all the personnel involved in the department and the HSE, and to all the people literally out in the vaccination centres and the GP practices, in the pharmacies, they all deserve great credit on what they have done to date and what they continue to do. And I think we can't say that often enough, because initially there was plenty of criticism, and most of us put that in a constructive way, but it turned out for the good. And hopefully with the booster vaccine, that we will have a similarly successful roll out as well. And I hope, Minister, you'll be able to push that out as soon as possible, because I know people are anxious, and particularly people working in healthcare and people at the coalface delivering services, oftentimes to vulnerable people, that they want to have the booster jab as soon as possible. Could I also say, and it was mentioned, I think it was by Deputy Kenny, in regard to ensuring that the whole world gets the vaccine programme as well. I just noted the Taoiseach said here the other day that we had to have international solidarity and a global vaccine supply, and it's very important. And I think any of us who would have been speaking here this day last year, we wouldn't have thought that we would have had such a successful rollout. So it shows what can be done when the global community gets together, when governments throughout the world put resources into dealing with a pandemic or dealing with any particular disease. What can be achieved? We spent some hours today at the Good Friday Committee speaking to the people who are developing an All-Ireland Cancer Research Centre. And Minister, they appreciate your support and that of Minister Robin Swan as well. And they have just rolled out to us what has been done on an All-Ireland basis since the Good Friday Agreement, since the first Memorandum of Understanding going back to the early 1990s. And that this project now is not just All-Ireland, it's transatlantic, with some of the major centres of excellence in research in the United States as well, and obviously linking up with colleagues in Europe. So it shows what can be done when the research is done on a collaborative basis, when people don't work in silos, when they work together, striving for the common good. Could I just say, Minister, I listened to you, I think it was the 1 o'clock news on Tuesday, and the one thing Deputy Shorter referred to as well, I was struck by when you quoted the figure that 1 in 3 establishments were not implementing the regulations in regard to the COVID certificate. I have to say, with the very little socialising I've been doing, like everyone else here, over the past 15, 16 months, I saw in my own county and in my own constituency, any hostelry that I was in, I was asked to produce my cert and it was checked. It wasn't just show your phone, it was checked properly. And it's most disappointing that if there's a town with 30 establishments in it, 10 of them aren't implementing the law of the land. It's not just acceptable, because you think of the 20 who are doing it well and doing it properly. And there can be no easing up on that. And Minister, I would say to the agencies, the Health and Safety Authority and the Health Service Executive and whatever other statutory agencies, that they must be firm in ensuring that the regulations are there for the benefit of everybody. And if one operator is strictly enforcing, and then all should, because it's for our benefit. And a person is happier to be asked for your certificate when you're going into a premises. And I think Deputy Shorter again referred to Dr. Holden coming through the airport and not being asked for the relevant paperwork or whatever. I've heard anecdotal stories. I wasn't at any airport, but I've heard those stories. Now, if employees of the state aren't implementing the law, it doesn't set a good example to people in the private sector that they should be implementing the regulations. So if people are going through airports and if there's a requirement that they have to show where they're coming from going to, or they have to show their certificate, there's no excuse for not showing it. And I sincerely hope that people will act responsibly. And the overwhelming majority of the people are happier if they're asked for their travel documents or asked for their COVID certificate. The overwhelming majority of the people in business and people going about their daily life, going out to socialise for a night or whatever, they want to be comfortable and that they're in a house that's safe and that's hopefully free from the virus. Could I also say, Minister, that I can fully understand why the government took a cautious approach on Tuesday. It was the very right one. The figures changed, unfortunately, for the worse relatively recently. And it was sobering again to hear Dr. Holden on the radio this morning talk about 86 patients, I should say, in ICU, and the hospital numbers had increased, and there was pressure on the hospital system. Like, we're going into winter time, and hopefully that pressure doesn't exacerbate the system, because we all know that the personnel working in the healthcare system, be it in the community or be it in hospital or residential homes, they've been under enormous pressure over the past 16, 17 months. Minister, we discussed within our own parliamentary party the whole area of mental health and how the pandemic has caused additional pressures on people. And I know that our colleague Minister Mary Butler has worked extremely hard to put in place additional resources to improve the delivery of services, and I think there's funding in the budget this year for reconfiguring and enhancing supports in response to the challenges posed by the COVID. And further improvements and developments in child and youth mental health will continue, and that's much needed. And the Minister outlined that a proportion of the additional funding will allow for the enhancement of child and youth mental health services, and that's all welcome and it's necessary. And again, both yourself, Minister, and Minister Butler have outlined the different initiatives that have been taken: information line, text lines, yourmentalhealth.ie, supporting the work of NGOs, and all of that additional supports that are necessary for young people who are going through difficult times. I'm going to just say, unfortunately, very recently in my own county, a young man lost his life, and his family spoke so well on the local radio recently, his parents and his siblings, about how their family member was bullied, and it was consistent bullying in different forums, and that they were anxious that the statutory agencies, departments, would take a new approach to the whole area of the crime of bullying, and that at least some confidential lines be put in place to ensure that there's a cross-government, a cross-agency approach, and that this area, that it can be addressed. We know of the bullying that's happening on social media, unfortunately, and it's a blight on society. And so many young people are being bullied constantly. At least when we were at school, you had a fight in the schoolyard over football or hurling or whatever, and you went home and it was over. And you didn't get a lot of sympathy at home if you were complaining about somebody pushing you and kicking you on the shins or whatever. That didn't matter. But you got on with, it was when you got out of the schoolyard, whatever messing was going on, it finished at that time. But unfortunately now, in far too many instances, the bullying is continuing online with detrimental consequences. And I think of that fine young 18-year-old, Ethan Heaslip, who lost his life following a series of bullying. So, Minister, I would hope that your department would play an active part, along with other government departments, in ensuring that there's a cross-government, a cross-agency approach to try and to tackle the whole area of bullying, particularly of young people, because it's bringing additional pressure on the mental health services. So it is huge pressure, and obviously if we can prevent some of the misbehaviour, the misdeeds that's happening, it will improve the quality of life for so many people, but it will also save lives. I know there's no simple answer, unfortunately, but Minister, I would hope that that your department could be central, along with understandably the Department of Justice, the Department of Children, that there could be a whole-of-government approach taken to ensuring that the requests of families who have gone through so much, but who never want to see it happen to somebody else, that their lived experience of the awful loss of a young person, that could be, that their suggestions could be taken on board and hopefully help some other person to avoid such loss of life or suffering to individuals as well. So it's an area that we need to address as a matter of urgency. It's happening person to person, but the online thing is a multitude of what's happening person to person, and it just cannot be tolerated anymore. And the social media companies, they really want to be taken on in a big way. The government have promised the establishment of a media commission, and I sincerely hope that that media commission will have the powers and the resources to take headlong the misbehaviour of the international media companies in what they allow to happen online. Thank you, Can Corla.